Welcome to the Interdisciplinary Potassium Management. Are we ready yet? My name is Karen Parinas. I'm a dietitian at Vancouver Hospital. I work as a dietitian in hemodialysis and peritoneal dialysis. I'm really excited to have you all here today to learn more about potassium management. One item I'd just like to mention is to please get into Slido. You'll be using that throughout the presentation. So, yeah, thank you. There's the slide if you don't have it at your table. So you'll be answering one question at a time as we go through the presentation. So just keep your eye on your phone in that sense. So we'll have a Jeopardy game and the music will cue you to go look at the Slido. We have a fun and informative session for you today. It's a 3-part session. So we have a panel, we have a Jeopardy game, and then that will be followed by a question and answer session for you. Did you know that potassium management goes way beyond looking into someone's diet for that potato they might have eaten last week or the banana they had the morning of blood work? So if that's you, you're in the right place here today with us. I guess the biggest hope for today is that your teams will develop a comprehensive, integrative approach to potassium management. Each member of your team has a special skill set, and we hope that we can integrate that together so that we can best help patients manage their potassium levels. I'd like to introduce our host for today. I'm going to be at the back managing the Jeopardy game. This is Tamara Graham. She's been instrumental in bringing today's session to you and to reality, and we really appreciate her perspective and input, as well as her dedication to joining us even when she was on vacation. So I'm going to leave the microphone to Tamara, and I'm going to head to the back. And I'll see you all in a little while.
All right, let's figure out where I want this. Can everybody hear me okay? Okay, perfect. So my name is Tamara. I'm a patient partner, and I am a patient whose potassium runs high. I've been in stage 4 for 8.5 years now, and since 2015. And I really credit nutrition and exercise and our kidney care experts, of course, for still being stable. That doesn't mean it's never going to fail. I'm sure that day is coming one day, but I try to do all that I can to make that day as far away as possible. So I'm really excited about the changes in potassium management that are happening right now. And it means for someone like me more freedom in eating, especially when I'm cooking at home and making choices. And I'm just really thankful to work alongside all these experts today who I'm going to introduce in just a sec. I'm just really, really excited that they're sharing their knowledge and expertise with us today. So please welcome our panel members. We have, in order from left to right, Michelle Wong, Kevin Kwok, Michelle Spittel, Leilani Borja, and Anna Lyn Delfino. So your generous contributions of time and sharing expertise has been invaluable. So thank you so much. Danny is out here, so I'm going to give a shout out to you as well. Danny Renouf. Everybody knows Danny. She's kind of famous in these parts. She's a dietitian at St. Paul's. If you don't know her, she was an ad hoc member of this group, and she helped with the guidance and input on some of this information. And she's gonna kill me for saying this, but I'm just gonna give her an extra shout out. She won a Circle of Excellence award the other day with Kidney Foundation for her input with the Wellness Hub as well. So first we have Michelle Wong. Welcome, Michelle. Could you please tell us a little bit about yourself?
Sure, thanks. So I'm Michelle Wong, and I'm a nephrologist focused on outpatient CKD care, and I'm also a researcher in kidney nutrition. And my role in helping patients manage their potassium is in addressing the multifactorial causes of high potassium. So this may include general counseling about diet, recommending laxatives, treating acidosis, and sometimes prescribing diuretics or potassium binders.
Okay, I have a question for you.
Okay.
So if you could ask colleagues to change one thing about potassium management, what would it be?
I think it would be to avoid overly restrictive diets. So traditionally, we've been taught to counsel on restricting high potassium content foods, but I now appreciate the concept of bioavailability, and not all foods that have high potassium content are bad. So the goal, this new paradigm of managing potassium would be to help liberalize the diets and hopefully improve quality of life of patients without or trying to minimize the hyperkalemia or high potassium events.
Thank you. I look forward to this. Our next panel member is Kevin Kwok. Thank you for joining us today, Kevin. And if you don't mind, to tell us a little bit about yourself.
Yeah, my name is Kevin Kwok. I'm a clinical pharmacy specialist at the hemodialysis unit at Vancouver General Hospital. My role in managing potassium is reviewing patients' profiles to see if any medications could be contributing as a side effect, and also working with the medical team to see if we need to start new medications to help manage their potassium.
Thank you. And I have a question for you as well. Have you learned anything new recently about possible reasons for high potassium?
Yeah, so I've been recently asking my patients more frequently whether their urine output has changed, because sometimes it might not be due to changes in their medications or their diet, but that their urine output has changed and they're now excreting less potassium.
Thank you.
Thank you.
Thank you. Okay, next I would like to welcome Michelle Spittel to the panel. Michelle, if you could tell us a little bit about yourself.
Hi, everyone. I'm a dietitian at St. Paul's Hospital. I work with the kidney care clinic as well as the in-center hemodialysis unit there. My role in helping patients reduce their potassium levels is to work with them in their dietary management of constipation and high blood sugars. I also educate and support the patients in choosing whole foods, whole fresh fruits and vegetables, plant-based proteins, and whole grains, and to encourage them to limit processed foods that have potassium additives.
Okay, I'm going to ask you the same question that I asked Michelle. If you could ask your colleagues to change one thing about potassium management, what would it be?
I would tell my colleagues just to stop asking patients to stop eating bananas.
Perfect. Okay, noted. Thank you. Next is Anna Lyn Delfino. And Anna, can you tell us a bit about yourself?
Hi, my name is Anna Lyn Delfino. I'm an RN at the patient educator working at the kidney care clinic at St. Paul's. I help our patients manage potassium by sharing information on the importance of medication adherence to if they've got any binders that they're taking, help investigate any causes of high potassium, such like medication or health changes like recent illness, and then just kind of help counsel them to manage these changes so that their levels are in an acceptable range.
Okay, I'll give you the same question. If you could ask colleagues to change one thing about potassium management, what would it be?
Probably to have an open mind when you're talking to your patients when it comes to their potassium, and listening to their struggles and just how to help them maintain, good values at their next blood work.
Perfect, thank you. Okay, so our final panel member is Leilani Borja. Thank you for being with us today, and please tell us a bit about yourself.
Hi, my name is Leilani Borja. I'm a nurse, patient educator with Anna Lyn at St. Paul's Hospital at the Kidney Care Clinic. So I help patients manage their potassium levels by teaching them also the importance of doing their regular blood work so that we can review it with them, and also talking to the patients and their families on the causes and the symptoms of a high potassium.
Thank you. Have you learned anything new recently about possible reasons for high potassium?
I was in that bubble about, just focusing on the fruits and the vegetable diet, but also just the importance of adequate fluid intake and managing constipation is also a reason for high potassium.
Thank you. Okay. This is a fun part. Thank you, everybody. We are going to get ready to play Jeopardy, but it's BC Kidney Day style. So we've got 20 questions. So make sure you have your Slido ready if you don't have it already, because that's where we need you to answer. And it's 20 questions, Jeopardy style, and we're testing knowledge about different strategies to manage potassium levels together. So here's how the game works. Each question will appear on the screen and a Slido will be activated, and you'll have 15 seconds to answer it on your phone. And so after that, we'll give you the answer, and then a member of the panel will speak to that question and answer. So are you ready back there? Everything good? Oh, see, that's why I checked. This is good. Uh-oh. Yeah, this is looking good. Perfect. Ready? Okay. I think we're ready. Yeah? Good? Okay, so we're going to get started. I'm going to read each question, and again, we'll wait 15 seconds, and then we'll have someone explain the answer after you put your answers into Slido. So here we go. Number 1. In patients with chronic kidney disease, excretion of potassium through this route increases. So we're looking for the root, the part of the body. All right, how did we do? How did we do in the Slido? Okay, so this is the answer. What is the gastrointestinal tract? Can anybody put up their hand if they got it? Oh my gosh, of course you guys did. You guys are experts too. Awesome, awesome. Michelle, are you able to speak to that?
Yeah. So on average, the kidney excretes most of the potassium in someone with normal kidney function. And then the colon will secrete only about 10% of the dietary potassium. But in people with end-stage kidney disease, the colonic secretion is increased to over 30%. So therefore, constipation is actually a really important cause of hyperkalemia in patients with kidney disease.
Thank you. Okay, so yeah, unfortunately we can't see all the Slido answers come up, otherwise we'd have to turn the game off, so we don't want to do that. But please make sure that you put your answers in there and I'll see who got them. Number 2, ready? All right, so this medication commonly used in the hospital to treat constipation may cause hyperkalemia. Music. Question. Uh-oh, Slido's giving a different question. What's it giving? Oh. Slido has skipped to number 6 for some reason. I wonder, did it go down? I wonder. No. Are we back? I'll give you a couple seconds. Is that a different one? Uh-oh. Okay. We are looking on Slido for the question that matches the screen. Number 2. It did go down instead of across. On Slido. Is that one on the Slido yet? No. Is it still the other one? Okay, so it's going down on Slido and across on here, I think is what's happening. I can work with that. Sure. Okay, we're just gonna take a minute. Okay, should we dance? We're gonna dance. We could do that question. Yeah, let's do the answer to this one, and then when we get back to the Slido, we'll go on to the next question. So the answer for this one, anybody know? Yes, I heard it over here. Fruit lax. Kevin.
Yeah, so in patients with CKD, we try to avoid any laxatives that have electrolytes in them that get cleared through the kidneys. And so one of them is fruit lax, which can contain potassium. So as you can see on the screen, 100 milligrams per tablespoon. We try to avoid phosphate enemas and magnesium laxatives as well. And we prefer patients to be on Docusate, Senna, or PEG.
Okay, I'm glad they haven't given me that yet. Okay, so how is the Slido good? We're good? Please hold. Well, we can start the question, and hopefully it'll come up in there. So you can see on the screen the question, what am I? Find me in processed foods. I have many jobs. I'm a flavor enhancer, flavoring agent, nutrient supplement, pH control agent, and a stabilizer or thickener. What am I? Is it coming up in the Slido, that question? Yeah, good. All right. Anybody want to shout it out? Oh, I can show the results now? Beautiful. How do I do that? Oh, they're going to show. Okay. Cue the results. Well, we've got the answer. So what is a potassium additive? Hopefully we'll get the results in the next one. What is a potassium additive? Michelle?
Yeah, so potassium additives are found in processed meats, canned foods, and packaged foods. So these are 100% absorbable. So it's important for us to teach our patients how to read labels.
Okay, thank you. This one is a true or false. Lifestyle question, true or false. Number 4, high blood sugar levels can increase potassium levels. True or false? That's probably all the time we need on that one, hey? What is true? That is the answer. What is true? Leilani?
Yeah, so when your blood sugars are high, potassium levels, the potassium leaves the cells and may build up in the blood. Having your blood sugar control having good blood sugar control will help keep the potassium at a healthier level.
Okay. All right. Oh, a wild card. I like these. Number 5, bioavailability. Michelle spoke of that, and she will speak to this again, is the amount of potassium absorbed from food. So which of the following has the highest bioavailability of potassium? Oh, I know this one. All right. Yay! Okay, we've got some Slido results. I love it. It makes it, yes, okay. So, processed chicken fingers is the answer to that one. Michelle, can you tell us why?
Yeah, so I'm glad that most people got that right. Potassium additives are often used to replace sodium in processed foods. And potassium additives have very high bioavailability, so over 90%. So there's going to be absorbed quite fully. And so this contrasts with plant-based foods that have less bioavailability due to their fiber content, but also fruits and vegetables tend to be base-producing, and they also induce insulin secretion, and those are things that can reduce the rise in potassium when you eat fruits and vegetables.
Okay, thank you. Yeah, bioavailability sounds like a good thing, except when it's something you don't want. Okay, so number 6. This hormone stimulates potassium excretion by the kidneys, and its deficiency can contribute to hyperkalemia. What is the name of that hormone? Okay, so I saw a whole bunch of things come up there. And the correct answer is aldosterone.
Yeah, so on the figure on the right, you'll see the renin, angiotensin, aldosterone system. And in those boxes are the causes of hyperkalemia due to derangements in this pathway. So ultimately, aldosterone is the important hormone, but all those other factors are all those other hormones in that pathway are also important. In patients with diabetes, there's often hyporeninemic hypoaldosteronism, and it's due to a reduced secretion of renin, and that is actually one of the main reasons why diabetes is one of the main risk factors for hyperkalemia. But there's also other factors as well in terms of the kidney function and medications and things like that. So often it's multifactorial.
Thank you. All right, number 7. These medications reduce potassium absorption in the colon. Awesome, there's lots of good answers on there. Potassium binder was what we're looking for, but of course some were named there. Kevin, can you speak to that one?
Yeah, so most of you guys got this right. So the most commonly used potassium binder is K-oxalate or sodium polystyrene sulfonate. We do have other options out there, including Lokelma and Veltassa and calcium or Solistat. It takes about hours to days, and you would usually prescribe these when other attempts to control their potassium doesn't work, such as diet modification.
Thank you. I have a question for you. This isn't in the script. So if fruit lax helps constipation, does K-oxalate cause constipation?
K-oxalate can cause constipation. That's probably the more common side effect, but anything kind of GI-wise, sometimes people can get diarrhea, but more commonly constipation.
Thank you. Okay, so number 8. This dietary pattern is associated with reduced hyperfiltration and urinary acid excretion compared to animal proteins. So what dietary pattern is it that we're looking for? Okay, so almost everybody got that one. Answer is C, plant-based diet. Michelle.
Oh, that's so great to see that everyone chose plant-based diets. So the benefits are, number 1, fiber content to help regular bowel movements. Number 2, alkaline effect to help move potassium intracellularly. And low bioavailability, so we don't absorb as much potassium from plant-based foods.
Thank you. Okay, number 9, lifestyle question. Which of these do dietitians promote as a way to limit potassium additives in the diet? Is it A, eating out often, B, buying packed foods, or C, cooking from scratch? Okay, that one. I don't think this is going to change. We're unanimous here. Oh, somebody wanted to. I think someone did that on purpose. No. All right, cooking from scratch is the answer, Anna Lyn.
All right, so making home-cooked meals gives patients more control over the types of foods they eat and can help reduce intake of potassium additives.
Thank you. Okay, wild card. This solution controls potassium levels through dialysis prescriptions. So it's the name of a solution. All right. The correct answer is dialysate. I'm guessing it's the same as the bath, right? So almost everybody got that. Leilani?
So the dialysate solution during dialysis facilitate the removal of the potassium and other waste products from the blood. The amount of potassium removed from the blood depends on the concentration of the solution. So the K-bath that everyone mentioned in their answers.
Perfect. Thank you. Okay, we have another true or false coming up, I think. Next slide. Number 11. So, true or false? Serum potassium varies with a circadian pattern. Sounds like I'm opening a beer. It's water. Serum potassium varies with a circadian pattern. Yes, it's true.
Yes, so most of you got that answer. So if you look at the graph on the left here, the upper line is the patients with chronic kidney disease, and the lower line is the people with normal kidney function. So people with CKD tend to have higher potassium values, but they both follow a circadian rhythm. So the peak will be between 1 and 3 p.m., and the lowest potassium will be at around 9 p.m. So it can vary quite a lot throughout the day. And if you look on the right, you will see that the range between the minimum and maximum potassium throughout the day is much wider in people with CKD. And it varies a lot more between patients with kidney disease as opposed to people with normal kidney function. So this is just one factor, the timing of the day, that will impact the variability in the potassium results that you see in those labs.
Thank you. I didn't know that, so I'm going to schedule my blood work accordingly.
9 p.m.
Yeah. Okay, so number 12. This medication helps patients with fluid overload and may decrease serum potassium. What kind of medication? Okay, so the answer we're looking for is loop diuretic, but there's also many examples of it. Kevin, maybe you could speak to that because there was a few on there.
Yeah, so most people got this right. The most common loop diuretic we use is furosemide or Lasix. Works on the kidneys by promoting excretion of water and electrolytes, including potassium. So when patients stop peeing, potassium is no longer excreted through the urinary system. And so when patients are anuric, we expect this medication actually to not work in terms of helping with fluid overload and also affecting the potassium levels.
Thank you. Okay, we're almost there. We're almost there. Number 13. I'm pretty sure we're all going to get it. An online resource for renal diet education handouts. What's a good spot you can go? A reliable online. It's a different one coming up there? Nothing at all? Oh, there's nothing on the Slido. There we go. That's okay, it'll take 1 second to answer. That's it, that's the answer right there. Well, there's a few, but BC Renal is one. And Michelle, maybe you can...
Yeah, we encourage you to visit bcrenal.ca and search for the diet page for diet education handouts on a variety of topics, including a new potassium management handout that was developed by the Renal Dietitians of British Columbia and created recently in March 2023.
All right, thank you. That's a really good document, and I would bet not everyone has seen that yet. Right? Okay, so what am I? Walking, biking, and yoga are examples. This is a pretty easy one too. Dancing, walking, running, biking. Yoga. Things I avoid. Oh, I love it. Okay, these answers are fun. Burdens. Lots of good answers there. I think we all know what the answer we're looking for is. Exercise. Anna Lyn?
Thank you for all the wonderful answers. Building or maintaining muscle mass may have an indirect benefit on lowering potassium levels through improvements in insulin resistance related to postprandial glucose and potassium uptake.
Thank you. All right, back to the board. We're almost on the last column. Last wild card, oh no, second to last one. Pseudo hyperkalemia can be caused by one of the following: traumatic blood flow, fistula occlusion, or poor blood flow. Oh, you can play the music. I'm just talking. It's all good. Okay. Looks like I'm going to let you speak to that, Leilani.
So the answer is traumatic blood draw, which is the cause of hemolysis, where it's the breakdown of the red blood cells during or after the blood is drawn. The ruptured cells can leak the potassium into the sample, causing a false high potassium reading.
Okay. Thank you. Okay, so we're in the last line here. Number 16, this cause of hyperkalemia is a common metabolic complication of advanced CKD. Okay, it looks pretty loud and clear on there. Acidosis.
Yeah, great that most people got that right as well. So we know acidosis is associated with a lot of negative health effects, especially on bone and muscle, and may impact the risk of progression of kidney disease. But acidosis essentially causes a shift in the potassium from the intracellular to the extracellular space, as shown in the figure there. A high dietary acid load may also contribute to metabolic acidosis, so things like meat intake. Treatment of acidosis may be through the diet in terms of increasing the base-producing fruits and vegetables, in addition to potentially prescribing bicarbonate supplements.
Okay, thank you. All right, number 17. These drugs are used to treat hypertension and can raise serum potassium. All right. So the answer is renin, angiotensin, aldosterone system inhibitors. Kevin?
Yeah, a lot of great answers there. So our two most common ones, the ACE inhibitor and ARBs, are beneficial for patients who have diabetes. And also for MRAs, we like to keep those on for patients who have heart failure as well, since it helps with cardiac remodeling. And so even though these medications can increase potassium, we really try to modify other factors before stopping these medications in these patients.
Thank you. All right, we're almost there. So the process of boiling a high potassium food once, discarding the water, and then boiling it again in a different water, is called what? It's pretty easy. And then you smash them and put them and bake them in the oven. They're even better. I'm just saying. Awesome. The answer is double boiling, but Michelle, would leaching, that would work too, right?
Yeah, double boiling, though, can reduce the amount of potassium by almost 50%. And it's not that tedious when you think about it. And it can, so some people may need to do this if they have high potassium levels. It's very effective.
Thank you. And your potatoes are better. Like, they are. Okay, so number 19. Common causes of constipation include... And we've got 4 answers to pick from on this one. Yeah. How did we get 102%? That was cool. Right. Okay. I think we got this one. All of the above. So inadequate dietary fiber, fluid restriction, and immobility can be a cause of constipation. Anna Lyn?
So with slower digestion, constipation can increase potassium levels in the blood, and so then it has more time for it to be absorbed.
Thank you. All right, last one. Last one. So, which of the following statements is a potassium myth? Okay, so the correct answer to this one, it's actually B, the correct answer, but I can see like the way it's worded, we can talk about C as well. Avoid fruits and vegetables because they're potassium sources. That's a myth. Michelle, can you speak to it?
Yeah, I think we all understand now that avoiding fruits and vegetables is not necessary in managing your hyperkalemia, because fruits and vegetables, they contain beneficial nutrients for your overall health. And although dairy, meat, whole grains, legumes also contain significant amounts of potassium, it's important to, instead of restrict based on potassium content, to consider the bioavailability and to address non-dietary factors that could affect your high potassium levels.
Thank you. So would it also be true then that there's no good or bad foods?
Yeah, that's true. No good and bad foods.
Awesome. Thank you. Thank you, everybody, for taking part in the Slido. Karen's going to come back, and we've got a few more things to do here. All right. Thank you. Thank you to our panel of experts as well. Okay, Karen's going to come back and talk to you about some more stuff. All right.
That was great. Thank you, everybody, for participating. I really hope you see all the contributions your team members can make and utilize them when making decisions about potassium management. Did everybody get a ticket? You didn't? Okay, well, yeah, we'll pass some tickets around because we have some really nice prizes to give you. Just half. Thank you, Stephanie. Give one, take one, and then we'll put it in the bag for the draw. Okay. Oh, what did I do with my? Oh, I left my phone. Yeah, exactly. Okay, everybody. We have time now for some Q&A. If you have any questions you'd like to ask the panel members. So you could type those into your Slido, and then I'll have a look at them. And Avi, could you put the Slido on the screen? I don't have my phone up here with me. Okay. Perfect. Okay, here's a good one. What is fruit lax? Michelle, could you describe fruit lax for us?
Fruit lax is a combination. It's like a pureed mixture of prunes and dates. Mainly prunes and dates, and it's has all the benefits of promoting a bowel movement.
You commonly see it used in geriatric patients. Yeah. And I guess one of the differences is that it's using dried fruits. So several dried fruits would be used to make just a little bit of fruit lax versus having a whole fruit or vegetable. Okay. Let's see. What happens to other nutrients and vitamins during double boiling? Would you like to take that one, Michelle? What happens to other nutrients during double boiling?
That is a great question. Danny will help.
So potassium is water soluble, right? So is sodium. So you're basically getting rid of mainly electrolytes in the double boiling process, right? So if sodium and potassium are important, which they are, you're not really losing a lot of other nutrients. Any type of cooking process does cause a reduction in some volatile, compounds and vitamins and things like that. But we are really in the weeds when we look at that. We're all deficient in fruits and vegetables across the board. So, and we also want to increase dietary variety. So now if we can do sweet potatoes, yams, potatoes more often, which offer a lot of nutrients, simply by double boiling, it's kind of like the benefits of that outweigh the cost of kind of micronutrient calculations and losses. I hope that helps.
Thank you, Danny. That's a great explanation of that. Was there any other questions from the audience? Michelle,
Yes.
Kevin? Yeah, go ahead.
I can, in my experience, when patients do have high Ks around, I guess, 5.5 to up to 6, and they do take regular K-Xlate, it can come down to pretty regular levels. I guess for a single dose of K-Xlate, after they miss it, I would expect maybe a 0.3 to 0.5 reduction, but I'm not sure if you have a specific number or just like estimate for that, Michelle.
Yeah, that seems about right. I think that in terms of like emergency planning and disaster planning, we often have K-Xlate for patients in case they were to miss their dialysis sessions. But so it can be helpful, but it is not very well tolerated on a sort of long-term basis. And in patients who are not on dialysis, about only 25% of patients with chronic hyperkalemia are actually prescribed Kayexalate. But we do try to manage all the other aspects of potassium before we prescribe a K binder.
Oh, a question from Tamara.
Just on the Kayexalate, does it, so if it helps reduce potassium, like it takes it out, does it only recognize potassium or does it we can give you the other nutrients? Okay, thank you, thanks. So my question is just going off of the answer to the last question on Kayexalate. I'm just wondering if it's taking potassium out of the body, does it take other nutrients with it as well, or does it just recognize potassium?
So I take it at the beginning. I can take this. So I have to kind of brush up on which one does what, but certain phosphate potassium binders can bind other nutrients or electrolytes as well. So calcium, magnesium, and potassium can be affected depending on which potassium binder you use. It's not actually taking any of those electrolytes out of your body. It's just binding the food that you intake through your colon or through your intestines. So it can affect that and can interact with medications as well, which is something we try to keep in mind. I guess is your question whether it will affect your overall nutrition if you're using it long term. That's not something that I've actually looked into.
Yeah, it probably won't affect your nutritional status, but so it's like an exchanger. So it'll bind the potassium in exchange for sodium, and the calcium polystyrene will exchange calcium and for the potassium. So but I think their tolerability is something that's a limiting factor. So they can cause a lot of gastrointestinal symptoms. That's the main side effect.
Thank you.
Okay, here's a question from the audience. Any tips to improve palatability of Kayexalate? Have you heard using Sprite, making into fudge, or other suggestions? Does it need to be mixed into water?
I'd drink it straight up and be done with it. Carry on.
Okay, so there's a good answer from somebody who's using it. That's a great question. All right. What should we tell patients now? Are they free to eat bananas?
So it's all based on their blood work. We need to think about their lifestyle and also their ability to afford fresh fruits and vegetables. So it's all individual, but the main message is, we want to improve their fiber intake, improve their intake of a variety of fruits and vegetables. First, always looking at the non-dietary reasons for a high potassium first and foremost before going into specifics of a diet. If a person is wanting half a banana or other fruits and vegetables in their diet, absolutely, I would encourage it.
Thank you, Michelle. Kevin, here's one for you. What are your thoughts on preemptively providing potassium education when starting an ACE or an ARB when potassium levels are normal at baseline?
Yeah, I think, for my population, at least in the hemodialysis unit, we do regular blood work. And so I guess from my point of view, I watch a little closer when they are starting on an ACE or an ARB and their levels are a bit on the higher side. I think if at baseline they're normal, I don't expect it to spike it to the point where we'd be worried. We probably would monitor a little bit more closely. I'd probably give more education to the patients who are on the higher end of their potassium levels and tell them how it can affect their potassium, and maybe get the dietitian involved as well to see if there's maybe preemptive diet modifications that we need to make when we start the medication.
I was also just thinking about, as you talk, depending if we're talking pre-dialysis or dialysis, the ranges of potassium are different. So you'd have to look at whether or not they're on dialysis yet and what potassium level you tolerate for them, I guess. Okay, here's one for Michelle. Please describe the future directions implementation strategy for potassium management.
Okay, thanks. So there was actually a slide, if you could go back. So we are planning to do an implementation study to assess the new potassium management resources that are available. So this includes the patient-facing handout that Michelle talked about, and there's also a healthcare provider facing handout or infographic as well. And so we would like to see their adoption by healthcare providers and as well patient-reported outcomes in terms of their enjoyment of diet and quality of life, as well as being able to look at potassium lab values. So if you go back one more slide, actually, on the presentation, there is the physician and other healthcare provider facing handout that's available that I helped to develop. Slide 51 there. So this was in conjunction with the International Society of Nephrology and some cardiology societies as well. So this is designed to address misconceptions or myths about potassium, and hopefully can be helpful for healthcare providers when discussing potassium with their patients.
Thank you very much. Is this new recommendation updated on the BCPRA website yet?
So this particular handout here, so this is available through the International Society of Nephrology website, and it's listed down there. The BC Renal website has the patient-facing handout, and the same principles are in that handout, but it's patient-facing. So this is a separate but international initiative here.
Yeah, and the newest handout that was just developed on the potassium management, it's all updated to focus on limiting the processed foods and focus on the fresh fruits and vegetables. So yeah, we're definitely disseminating that information to all of our patients now.
Thank you so much. The final question, will the presentation be available? Did you mean this presentation? Yeah, I believe these are all going to be available on YouTube at some point in the future. On the BC Renal website? Okay, perfect. All right. Okay, here's one last question we can squeeze in. When they draw for pre-K, the results take a considerable time, and when you receive the results, it turns out to be exceptionally high. What would you do? Just a question, is that coming from an RN, that question?
Yeah, so this is like a pre-dialysis potassium,
yeah.
and by the time you get the result, they've already finished their hemodialysis run. Well, I'd say that it may not make a big difference. The dialysis run will reduce the potassium depending on whatever potassium bath that you had. I think that it's hard to know exactly what their post-potassium will be without doing a post-HD measurement. But for the most part, the potassium will be reduced to a acceptable level, a level that's not going to be dangerous.
Okay, and I think depending on how high it is, we would probably do a pre-K the next day, and by that time, the relevant staff would be aware of it.
Yeah.
Okay.
So you're going to be drawing.
Yeah, I'm gonna ask everyone here to draw. So get your tickets ready, and then if your number is called, come on up to the front to get a ticket.
All right, I have 0861838. 0861838. You can come up.
So next number 692158. 692158.
The next number is 0861842. 0861842.
So the next one is 0861885.
Okay, the next one is an orange ticket. So it's 692196. 692196. No one? Do I grab another one? 692196.
The orange ticket.
It's an orange ticket. No? Should I grab another one?
Yeah.
I'll grab another one. So it's another orange ticket, 692193.
Right. Awesome. How many more? 4 more. Okay. All right, we've got 4 more prizes. Thank you. All right. Let's see. This one. 0303272. 0303272. All right. Awesome. Want to go back that way? I'll just do them. All right. So we got 3 more? Okay. I won't look. All right. So 0861853. Awesome. Oh, nobody. I thought we had some cheering back there. No? 0861853. Okay, let's try another one. Orange ticket 692388. Yay! Awesome. 2 more. I know, I see people with lunch. Don't worry. I'll get you there. Here we go. 0861848. 1848? Yes. Awesome. All right, we got 1 more pair of socks. Orange ticket 692187. 692187. Awesome. Thank you.